Hello everyone. Today I would like to share an interesting case related to penile prosthesis implantation. The key point in this case is that the patient had a relatively short penile length compared to the average, which makes the selection of the most appropriate prosthesis particularly important. Before surgery, I measured the stretched penile length, which was about 6 centimeters with a circumference of 7 centimeters. In patients with a relatively short penile length, I generally do not recommend a malleable or semi-rigid prosthesis. This is because patients may have difficulty bending and concealing the device, which can cause discomfort in daily life. Based on my experience, the minimum penile length suitable for a malleable prosthesis should be approximately 4 inches or about 9 centimeters. Therefore, for this patient, I recommended using an inflatable penile prosthesis. However, when choosing an inflatable prosthesis, we must also consider which model and diameter would best fit the patient's anatomy. For this case, I prepared 2 options: the standard Coloplast Titan inflatable prosthesis and another model called narrow base, which has a smaller cylinder diameter than the standard version. The treatment plan was to implant the largest prosthesis that the patient's anatomy could safely accommodate. However, if the anatomy did not allow the standard size, we had a smaller alternative available. At the beginning of the surgery, the initial steps were standard. We prepared the spaces for the cylinders, the pump, and the saline reservoir. However, during dilation of the corporal bodies, I found that the space could only be expanded to 11 millimeters in diameter. This means that the standard cylinders, which expand to about 21 millimeters, could not be used. Therefore, the most appropriate option for this patient was the narrow base cylinders, which have a diameter of about 17 millimeters. After placing the prosthesis, I checked the function of the entire system and carefully positioned both the pump and the saline reservoir for optimal usability. When we tested the prosthesis at full inflation, the penile length measured about 8 centimeters with a circumference of 9.5 centimeters. At this point, I would like to emphasize an important concept. Penile prosthesis implantation does not significantly increase penile length or circumference. This is something that must always be clearly explained to patients before surgery. In the end, careful surgical planning and selecting the most appropriate device for the patient's anatomy are essential to achieving good outcomes and patient satisfaction. Thank you very much for listening, and I look forward to sharing more cases in future episodes.